So last month when Walgreens would
I commented on Michelle's video last night, and then there were a bunch of comments this morning. So just wanted to stitch it to see if maybe I could add a little bit, maybe I could help a little bit. So for background, I've been working in pharmacies for over a decade. I have the coolest job right now where I work in a doctor's office, but I handled the pharmacy side of it. And so my team, in total, there's like four of us. We do dozens of prior authorizations a week. We also work on financial assistance, copay cards. We do it all. So we do a lot right now, time of year. It sucks. Everything is expiring. Patients are running out of financial assistance. Anyways, I could go on a huge rant about this. It's awful. The way that it works for prior authorizations, doctor writes script goes to pharmacy runs the claim, insurance says, nope, we're not paying for this, mostly because it's a money game. Everything's about money. It's awful. I could go on a rant, and I do all the time. The pharmacy can initiate a prior authorization request back to the doctor's office, typically with a system called Cover My Meds. It triggers a key code either electronically or through fax that'll go back to the doctor's office for them to complete the prior authorization. It says pretty much along the lines of your patient cannot start this medication until you do the prior auth. At that point, you can call your PBM, your pharmacy benefit manager, and see if they will allow you to complete the prior auth. It could ask for some clinical questions potentially. If that's the case, you may not be able to do it. I did my own prior authorization for Mounjaro. I just input my doctor's information, input my information, input the medication information, and my diagnosis code, which is, weight management, completely off label. And my insurance approved it with no other questions asked for 2 years, which is amazing. Not the case for everybody. You can, do it over the phone. You can try it that way, or you can dig through your insurance. Every policy, every plan is going to be different. If you have access to Mounjaro at this moment, hold off on doing it. Formularies and policies, insurance policies, are going to reset January 1st, like they do every year, and medications are going to get added to formularies. Insurances are only willing to pay for medications that are given to them the cheapest by the drug companies. It's a money game. I could rant. It's bad. Medications could get added to the formulary. If you initiate a prior authorization right now and it gets denied, sometimes you'll have to wait a minimum of 60 days to reinitiate a prior authorization. But if you wait until January 1st, the medication could potentially get added to your formulary and make the process 10 times easy for you. So if you have access to it right now, or you're good until January 1st, wait until January 1st. And then start doing digging, and then call them and see if you can initiate your own prior authorizations. Let me know if that doesn't make sense. Let me know if you want any follow-ups. Happy to talk about it more. Got a lot of experience, been doing it for a long time, and this is a frequent conversation I have with patients.